My topic is about mental illness, breaking the stigma and raising awareness. I don't know if you guys know anyone who has mental illness or suffers from even mild anxiety, but I've heard so many times people say the word, "Oh, my mom's so crazy," or "Oh, she's bipolar, she changes her mind all the time." But if you've ever met someone that really has bipolarism or really does have a serious mental illness, it is very different. I always remember thinking like, "Oh, I wish my mom was that crazy." And there's a reason why you have to take psychology, I believe, in college, because you need to better understand people. You can live a normal life even with a mental illness. And when I was doing research about it, it's kind of funny, the history behind it all. I will go into the ancient history. As you can see there's some interesting pictures. The mental illness used to be considered a possession, or it was a punishment from God. You must have done something very sinful, and you need to go to church. You need to have an exorcism. There was this in 5000 BC called trephining. They would drill a hole in your head to try to get the demons to come out. And they would also give them magic poisons to make them throw up, because that would expel the demons. Or they would give them laxatives to try to, I guess, shoot out the demons. I don't know. But fortunately, the ancient Egyptians were one of the most forward-thinking about mental illness, because their prescription for it was to do things that you loved. You should go to concerts. You should go dancing. You should play instruments. Things that bring you peace were their prescription. And in today's society, that is kind of the same, along with medication, of course. But in 5 BC, Hippocrates treated the mentally ill by giving them little herbs that he would create. And, okay, there we go. And he would encourage them to change their profession or to change their environment. And if you suffer from mental illness, you know that sometimes you have to step outside to kind of get away from your surroundings to heal. So that was very forward thinking as well, even back then. But then we get to the Middle Ages, where everything gets interesting, and apparently bleeding out helps with every illness, from a sore thumb to mental illness. So they would also encourage vomiting. They would encourage being blood let out, because they believed that when you were mentally ill, the different 4 types of blood that you had inside of you were off. So if you drained it, it would help you get better. And the first mental hospital was established in 792 CE in Baghdad. And right here is a picture of the trephining. And this is also a chair that was created by the Dutch Dr. Barhelp. It's called the gyrating chair. It basically just shook the crap out of you. And basically all it did was made you pass out. But they thought that for some reason it would shake all your blood. Your blood was separated, and you need to shake it together to not be mentally ill anymore. So a little bit more recent history, there's this lady named Dorothy Dix that was a school teacher that unfortunately had to retire because she contracted tuberculosis. So she ended up working in a women's prison, and she saw the horrific environment that these people were living in. She said that they were living in these cramped little rooms, kind of like this picture with the number 5. They would not clean. They were in a padded cell. They had their arms wrapped in a straitjacket. And if they were allowed to come out, it was basically just sitting in melancholy, looking at each other, being all depressed. And electroconvulsive therapy began in 1933. They started with insulin injections, and they would inject so much insulin into a patient that they would end up passing out. And so since that obviously didn't work, they decided to electric shock therapy someone, and that started in 1938. And actually, electric shock therapy, as scary as it sounds, still is practiced today. It's just done in a very different method. My brother suffers from PTSD, and he gets ETC done, but these are only in the most dramatic of cases, like if you can't heal with medicine or whatnot. In 1935, Igas Moniz performed the first lobotomy with the aid of Almeida Lima. And if you guys know what lobotomy is, it is a very brutal practice. You basically get an ice pick, you put it behind your eyeball, and you get a hammer and you jab at it. And on this picture right here, I actually watched a documentary called Blood and Guts, and it talked about this kid. And he's still alive to this day, and they took a scan of his brain and compared it to someone with a normal brain, and his whole entire frontal lobe is black. There is no activity in his frontal lobe whatsoever, because where they would put the hooks was right where that was. So there was a 25% death rate, and of the other 75%, half of them got even crazier, and then half of them became just vegetables. So dealing with a vegetable, I guess, was dealing better than dealing with someone hysteric. And an interesting fact, I can't remember her name, but a Kennedy, like of the presidents, had gotten a lobotomy done. So it was done up until the 1950s, which is kind of weird to think that that was only not even a century ago. And in the Inquiry's Journal, it said that JFJ Cade introduced the psychotropic drug lithium in 1949. If you guys know anything about Nirvana, he sings about it. A series of successful antipsychotic drugs were introduced in the 1950s that did not cure psychosis, but were able to control its symptoms. Chlorpromazine, commonly known as Thorazine, was the first of the antipsychotic medications discovered in France in 1952. Valium became the world's most prescribed tranquilizer in the 1960s, and Prozac, introduced in 1987, became the most prescribed antidepressant. Now, a little tiny fun fact history about me is the reason. Wow, I don't know how that happened. Okay. The reason why I'm so, I guess, into mental illness is there is mental illness that runs rampant throughout my whole entire family. I was born in 1987, and my mom was on Prozac. She had postpartum depression with me, and my dad said when I was about 1 month old, she told my dad that she understands why women kill her children. So that's not really a normal thought process that someone who is stable would say about their newborn child. And my mom had everything she had ever wanted. She was married. She had a husband who loved her. She had a home. She had 3 kids. And coming from the life that she was from, this was supposed to be her utopia. But she could not find happiness anywhere. She was miserable. She laid in bed for 2 years. She couldn't even get up to feed me. So my sister said when she would come home from school, I would be starving. So then in 1988, I want to say, my mom went and got on Prozac, and it changed her whole entire life. She went around telling everybody how wonderful she felt, and actually 4 people that I know of personally have told me that my mom was the one who saved them and got them on Prozac, because back in the late 80s, early 90s, no one really talked about mental illness. It was so hush-hush. You didn't want people to think you were a failure as a mom. You didn't want them to think that you were ungrateful for what you had. But if you know anything about mental illness or depression, you can't switch out of that mindset no matter what you try. It is a chemical imbalance for sure. So these would be some of the reasons why you would get admitted to a mental asylum in the 1800s. A fun few of them is women trouble, young lady in fever. I also like asthma. I guess you're crazy if you have asthma. Death of sons in war, sunstroke, severe labor, a dog bite. What's another one that was really good? I'm going to say time of life. Because there's just a time of life where you just need to go to a mental asylum, I guess. And so these are all just obviously not mental illness related. I mean, some of them obviously are, like sexual abuse would be, because that does cause long-lasting trauma. But some of these other things, they were so far off in the mental health knowledge that it's funny to think of what they really thought were mental illnesses back then. But let's get into what some realistic things about mental illness. And in the National Institute of Mental Health, it states that in 2016, 1 in 6 Americans suffered from any mental illness. So that's about 44.7 million people. That means there are 18 people in this room, 3 of us have a problem, and I am one of them. But that's why it's so important for us to know about psychology, or at least know a little bit about it so we can deal with each other, because there's going to be someone in your family that has a problem. There's going to be someone that you deal with at work that has a problem. And if we have this stigma that they all need to be straitjacketed and thrown away into a padded room, that doesn't enhance our society at all. And all it does is make a burden upon taxpayers, because then we have to pay a bunch of money for them to keep these facilities open. There are some signs and symptoms of mental health. There's a lot of silence that goes on with it. Some people still feel very ashamed to admit that they have problems. And it's important for us too, as people, to notice people that are around us every day if they're starting to change. If they used to love playing soccer every single day and now they don't even want to get out of bed, they might have a little problem going on. There's withdrawal, there's drop in functioning, problems thinking, collecting a clear thought, having rambling thoughts all jumbled together, increased sensitivity, even migraine sometimes will come with that, which can induce vomiting, and obviously not feeling good. You can feel disconnected, you could want to withdraw from people, you could want to isolate yourself, nervousness, irrational fears, unusual behavior, odd characteristics. A major one is sleep or appetite change. If you notice someone around you is rapidly losing weight, not sleeping, having problems, then you might want to kindly address to them if they're dealing with any issues. And mood changes. I think that one's probably a very obvious one when someone has a mood change, that they might be dealing with a little mental illness. And mental illness they commonly appear in people at the ages of 18 to 24. In my family, we like to get ahead of the game. My sister was suicidal since the age of 7. My brother was put on anti-anxiety medicines at the age of 8. And my mom, one of her report cards said she's great at reading and writing, but I think she might be very depressed. So this is back in the 60s that someone noticed that something wasn't right. And the thoughts that come along with that are feelings of failure, hopelessness. You can feel overwhelmed just by everyday activities. Some things can just be what I would call the blahs, but if these things are starting to incorporate into your daily life where it makes it to where you cannot function, then you probably should go seek some help with that. And what are some effects of mental illness? Like I said, there's the inability to function. My mom was in bed for 2 years because she couldn't even find energy to get up, to get out. And there's a high risk of being incarcerated. Especially with bipolarism, people tend to go on a high and they just kind of do, woo, whatever, this is the best day of my life. And then they have some very big consequences that will lead them to jail or sometimes other worse situations. But a lot of the homeless community have major mental health problems, and that's because they have so much trauma and they haven't learned how to deal with that, and they just kind of get in a rut and just drop and get frozen in time. I describe it. They just are living day by day, almost on survival mode, but they don't have feelings of hope that things will get better, so they continue in this rut. I feed some of the homeless people in my park, and just hearing them talk, it's actually very sad. I try to be encouraging to them, but when someone's in that mindset, they have their own, there's just no trying to talk them positive sometimes. But I still try. I'm not going to quit doing my thing. So if mental illness goes untreated, it can get extremely worse. You can lose your job. You could lose, you can become a victim of trauma because you're so down upon yourself that you'll just let anyone treat you however you want and you don't know how to stand up for yourself. So then you can get caught up in that situation. And unexplained aches and pains, there's something called chronic fatigue. And I have suffered from that, and I know other people that have. It's linked with depression. You just feel sick. You can't explain why. You feel tired. You ache every time you move. Your back hurts. It's almost like fibromyalgia-esque, but you're extremely tired, and you don't know why. You just can't wake up. And then one of the worst ones is suicide. Suicide runs rampant in my family. Like I said, my sister has been suicidal since the age of 7. My brother tried to commit suicide from an untreated mental illness in October of 2016, and my mom committed suicide in December of 2016 from a mental illness. So it's very serious if you're feeling any kind of, it seems like we're being dramatic when we feel these things, but it can get to a very dark place if you don't let it. It's not something that you should just write off as, oh, I just had a bad day. If you're having a bad month or a bad few months, there is no shame in trying to go get some help from somewhere. And 37 of these mental illness sufferers end up becoming alcohol abusers, and 53% of drug addicts have a mental illness as well. So a lot of these alcohol abusers and drug abusers are just trying to self-medicate because they know they don't feel right and they just don't want to feel anything because what they're feeling is horrible. So if someone comes up to you and they want to tell you that they have a problem, there are a few do's and don'ts. Don't panic or overreact, and don't be judgmental. It's very hard for them to approach you, so just listen with an open mind. Speak slowly and simply because their brains are not as reactive as you think they are. If you're joking like how you usually joke, they might take it offensively and get upset and shut down. You don't want to threaten them with anything. You don't want to say that you're going to call whoever on them. You want to let them decide what they want to do in some sense. And stay positive and encourage help. And don't ever hesitate to contact a mental health profession. And then this little quote, never give up on someone with mental illness. When I is replaced with we, illness becomes wellness. And these are some places to find help. Mary Kay Shell Mental Health Center here in Bakersfield, Crestwood Behavioral Health, Kern County Mental Health Services. You can call the National Suicide Prevention Hotline. Even if you're not suicidal, you need some information. There's 24-hour operators. There's also Alcoholics Anonymous, American Association of Suicidology, which is for people who know of those who have committed suicide. Dual Recovery Anonymous, Male Survivor, which is men who have been sexually abused. It's a safe space to go to talk about it. And Survivors of Incest Anonymous are just a few support groups to help, because sometimes it is embarrassing to go to your family and tell them that you have a problem. But these groups are very non-judgmental, and it's a great place to get help. These are some famous people with mental illness that you probably would never even guess. My boyfriend, The Rock, being at the top. Adele, that I noticed that you talked about. There's Robin Williams, Marilyn Monroe, Abraham Lincoln. Mariah Carey just came out. Heath Ledger, Kurt Cobain, Wayne Brady, Kendrick Lamar. So it's not as weird as people think it is to have a mental illness. It's actually very common. These are some alternate therapies that you can do. You have to just find what makes you happy. Gardening, a pet. Pets are very good with therapy. Yoga, meditation, art, eating healthy, journaling. All these are different ways that you can clear your mental health.